told you he was here. He's like, okay, I'm gonna tell you all about it. Oh boy! Oh boy!
I see that.
Okay, let's put this down.
Okay.
Put this
Well,
here.
right here is a good area for my video.
Perfect.
I have a field of view from over here.
Perfect.
Okay.
All right, Dave. Okay, Mama.
Okay. First off, how about just the proper way to pick her up, just like you did?
Or
Like when I have to lift her in and out of the car.
when you have to lift her in and out of the
or
car,
something else.
this is totally fine to be like
Okay, there and
this.
there. Okay.
Yep.
All right.
To be like this, just so you're
Okay.
supporting her back. I know. Okay, I'll turn you to show.
Alright.
You can face Daddy.
Okay.
Daddy's gonna make you a star, though. He wants you to.
Yeah, well, I don't know what we're doing here.
Yep.
Because the recovery is just as important as surgery.
So even just getting her to stand on a surface, not a surface like this, because it's too slick.
Yeah.
But if you have
Pad.
carpet or a pad,
I think we have a pad.
or even outside, like on grass or on like a patio.
Yeah, okay.
Okay.
I heard her. I heard
Yeah.
her.
So yeah,
Maybe
just
start-
getting her to stand so that you have all four feet
Okay.
need to be just like this.
Well, this is amazing because she hasn't been able to do that since she had her first episode.
If you watch her when she's with the sling, she will try. She will try with each one. It'll start off
She'll-
like this, but
she'll
then
try
she'll
to-
try and flip it like that,
Oh,
and she'll
so
take a step with it
She'll
like
try
this.
to go for
So
it.
she'll be like
Okay.
this for a moment, and then.
Something like that.
So
Okay.
when you're slinging her,
Mhm.
you want to support. You don't want to take all of it up, so you don't want to put a lot of pressure on this. You just want to
Okay.
put just enough so that she
To get up
is
on
kind
her
of
own,
resting.
so she can get up.
Yeah, correct.
Well, now you don't even have that right anymore.
Okay. Oh no, this is perfect. We just had
Oh,
it.
you mean through
Yeah,
here?
we had it looped
Oh,
around.
right through there.
Yeah.
Oh, so that's
See?
okay.
Yeah, that's totally
Oh,
fine because we
okay.
just didn't want to put a lot of pressure on
Oh,
her
on
neck.
her neck. Oh, I see.
Yeah.
No, I didn't know that. Okay.
That's fine. So yeah, so you
Alright.
just want to put just a little bit on here.
Mhm.
Most times when I'm walking them, just so that I know I'm not
Yeah.
pulling up too much, I'll do just one or two fingers and hold
Okay,
it
so
just
not
like
a
this.
regular collar and thing,
Yep,
but a loop
yep,
like this
yep.
through there.
So when she's
Okay.
going outside,
Yeah.
because she's going to still be restricted on her activity, at least for the next couple of weeks, when she's going outside, leash and the harness on, and then let her do her business outside, and then she goes right back inside.
Okay.
All right. So this is what we call like a static stand. So it's just getting her to stand, and usually we'll do it for anywhere from 30 to 60 seconds, a couple times. Like
Oh, as
maybe
part of
2
the
to 3
physical
times a day.
therapy to get her
Yep.
up and
Yep.
standing.
And just have her standing like this.
Right.
It's totally
okay.
fine.
Okay.
And then we do what we call like toe. The toe pinches will be here. So it's just, I can show you on her side. It's easier on that. So we'll put her on her side. You can look at Daddy. I promise. You can look at Daddy. But we're going to go on our side, all right, monkey? All right. Well, I'll let you hold her head.
Okay.
And then we're just going to, just like that.
Just down
Boom, just like that.
Oh, I
Yeah, it's
see.
right there.
This one, that one. Oh,
Yep.
Okay. I'm supposed to
Yep.
say, okay.
So then for her back legs, she gets a little stiff. But then if she gets a little stiff and doesn't want you to bend it, then I would just start moving it a little bit, and then she'll let you bend it. And then stretch.
Yes, I know.
You're going home.
She
I
says,
told
well, I
you.
don't want that.
I know. And
You
then
don't want
it's
that.
just moving
Okay.
like she were walking.
So she shouldn't have unusual pain because she didn't have any
No.
surgery there.
No.
It's a matter of getting those
Exactly.
muscles
Yeah.
talking through here. So
Exactly.
That's what the goal
Yep.
is.
Yep.
To get that stuff talking through.
And then
Oh,
just-
and then range of motion to get blood
Exactly.
into it.
Yep. To kind of just exercise everything because she wasn't using them, and then with the surgery and with physical therapy in time, the hope is she'll be using them. So this kind of just helps retrain and just kind of helps exercise everything.
Well, she doesn't mind that too much.
No, once she's
out.
healthy, and I'm sure this place they get all excited here. But yep, just bending and stretching
Okay.
and then moving.
Now we're rotating. Okay.
Yeah. And just kind of go like she were walking. And then the toe pinches, the girls usually will go in between here. I usually just pull this, but she's pulling back just a little bit, which will come with time.
Okay.
So, and that's what you want to do.
So it's just a pinching of like, like in
just
there.
right in here until she
withdraws.
she'll pull it back.
So she says, I don't like that, and I pull back.
Exactly. When they start feeling better, a lot of owners report like they're like, no, and the dogs are like, no, stop
She always
pinching the
pulls
toe.
like that when she's had her nails trimmed, so that's.
Probably.
Okay.
So that's good.
All right.
So I usually do this anywhere from, I believe
Now,
it's
which
on
one
that
was the
sheet.
worm compact? Was that for the one that you just did?
Let
Put
me
the
see.
worm compact on it before that?
Let me grab the sheets and I'll show you that. You show
Well,
me
it's on-
that,
I
and
think
then
it's
you
on-
stay there.
it's on
Grace.
there.
Okay, let me grab the sheets so I can show you the pictures too.
Oh, okay. You're such a boo-boo. You're such a boo-boo. No, we're not done yet. So we're done. We're going home now. I'm all good now. Yes, I know. Yes, Oh, you're such a star. You're such a
Alright,
star.
Daisy, you're good. You're so good girl. You're silly. But yeah, here's some pictures too. These kind of neat too. But yeah, so these are the toe. So they kind of grab the whole foot. You can do that. You can do just this too, because she's pulling back. That's not me. That's her pulling that back.
Okay.
So anywhere from, she usually likes 10 times doing that to have her pull it back, a couple times a day.
Right.
So whatever works in your schedule.
Okay.
And then the other one is the range of motion, which we were just doing with the kind of circling. And then a lot of times we do them all together because she's already on her side. So we'll do the range of motion and then they'll do the toe pinches and then they'll rotate her to the other side and do the same thing on that leg.
Okay.
And then here's the assisted stand, which I was showing you. They have, you can do that. Sometimes I like this just because you
Well,
can kind of help.
that's gonna be helpful for
Exactly.
the going out to the dog run for the body stuff, because that's on uneven rocks, so it's
Okay.
a little, I mean, it's not just like this, it's more like this with the rocks.
Yeah.
I mean, where she has to kind of negotiate the size of the rocks and so.
Yeah. So, I mean, you can do the assisted stand with this. You can do this with just a little bit of just your arm underneath her. Again, using the same concept as this, not really putting so much that she's laying on your arm, but that she is equally distributing the weight. Yeah.
Okay.
Yeah. So yeah, and they show you here. So you don't want her feet to be under. You want them to be perfectly placed.
Now, what am I doing exercise-wise?
This is just helping her stand and getting these.
Oh, so
muscles.
she needs to stand for 30 to 60 seconds for. What if she's standing and is standing, then?
A lot of times, once they start getting better, by the time we see the owners for the 2 weeks, they're standing on their own.
Yeah.
So yeah.
So allow her to, as she can, accomplish
Correct.
that. Okay.
But for now, because she still doesn't have quite the strength in her back legs, we'll have you just kind of assist her in standing. So like I said, you can use this, or if you're on the ground with her here and you have something like this, you can have her standing in front of you right here.
Okay.
And I think that was it. Oh, nope. She got a bonus one. Yep. So if you can, I put this last because we kind of want to build up to that, but this is another one to try. So if she was a good sitter before all this happened.
She'd sit for a treat.
Yeah, so we can do that. You can have her try and sit, or you can start her off sitting and then have her, whichever way, like if she is starting to stand.
To a sit or sit to a stand, just as long as she goes through that range of motion.
Yep.
Okay.
You're so silly.
So it would be to try to get her, and you're saying this is a little later.
Well, you can.
In the PT.
You can double check with Dr. Gietzen. I just put it as kind of, I go from easier to hardest on these. So like the toe pinches and the range of motion, pretty easy because you're doing a lot of the work because you're helping her. Versus like, and then with the stands, that's going to be more on her, and then the sit to stands is going to be more on her trying to do it by herself. Yeah.
Stand to a sit or from a sit to a stand.
Yeah. So you can double check with Dr. Gietzen. Like I said, she'll come back and we can ask her like when she wants you, if she wants you to start that immediately or start with just these for now.
Okay.
So, but that's it. That's all of her exercises that she's going home with for right now. Any other questions for me? All right, let me go get Dr. Gietzen then. And this is your sling, brand new one for you.
No, that's fine.
Perfect.
Okay.
All right.
My wife was thinking of getting something like this on right at home.
Perfect,
So
yeah, that's gonna make things easier for you
Yeah.
folks.
Okay.
And then her old meds are in that bag as well,
Oh,
and then the
alright.
2 new ones are in there, and I put a pill cutter in there. The gabapentin is a chewable tablet, so it's pretty easy to, and it's scored, so it's pretty easy to snap that in half.
Okay.
That's the one for pain medication, and that's every 8 hours. She does take them, like I said, very well. And then those are your meds. And then this one is going to be,
Saturday.
yep, and it's yep.
And I'll use that if she's getting anxious or trying to keep up with the pack or needs the rest and she hasn't.
Exactly, yep.
Get her going.
That's on an as-needed basis.
Yeah, okay.
Okay,
Alright.
alright, let me go to Dr. Gietzen.
If that's it, did you have any of the food left over? You
Oh,
took
yeah,
that?
let me go get that. No, I think that the girls had a little bit left over, so I'll bring that to you.
Alright. You got some left over, good. Alright, that's the end of the video. Bye guys. Thank you.